According to the Radiological Society of North America, children are more sensitive to radiation exposure than adults, so it's very important to protect young patients who need imaging tests done. We spoke to Dr. Nathan Holmes, a pediatric radiologist at Children's Hospital of Orange County, who talks about what he sees every day.
Imaging plays an important role in dealing with children that are coming into the hospital with different conditions. We do MRIs for a lot of kids with seizures, and we also do some procedures in the radiology department specific for illnesses and diseases related to children. Kids, when they come to our department for different imaging procedures, we do treat them differently. We can't just roll them up right underneath the fluoroscope or put them right in the gantry of the CT, because it is scary to them. And one thing we do is we work closely with Child Life program here at CHOC, and our technologists are specially trained to deal with kids, so we do have to put them in an environment that they're a little more comfortable in. And that's a big difference between pediatric imaging and imaging that goes on in an adult hospital.
How do you calm a child down when they don't want to have an imaging test done?
We'll try to talk to the kid in terms that they understand at their level of maturity or their age, and try to explain to them what's going to happen, make sure there's no surprises to them. And oftentimes we also have to do the same with the child's parents, because we see a lot of times the anxiety of the parents sort of gets transferred to the child in different situations, particularly, and we see that in our department with imaging. So we have to often explain to the parents so they understand and can help us along when we perform an X-ray or a CT or a fluoroscopic exam. Reading images in pediatric radiology is a little bit different for sure than in the adult world. A good example is someone who comes in with right lower quadrant pain. That's pain down in right lower corner of their abdomen. In the adult, the differential diagnosis is pretty long, but in the child, it's usually a little bit smaller. So even though we may not have a really good history that an adult may be able to give the ER physician or the radiologist, you have to tailor what you're looking at in the pediatric world.
Dr. Holmes shares a patient's story.
We had an 8-year-old child present at an outside hospital who had abdominal pain and underwent a CT scan, a CAT scan of the abdomen. The way the CAT scan was performed at the outside hospital, they didn't use intravenous contrast. When the child presented to our hospital, we did the examination again, protocoled it in a more specific way and gave contrast, and we were able to diagnose a condition where the child's spleen had twisted on itself, which is very unusual. But by understanding what we needed to look at and making sure the CAT scan was protocoled correctly, we were able to make a diagnosis which was very unusual, but really helped out the surgeon in knowing exactly what to do and what was causing the child's pain. When you have a child that needs an imaging study, let's use a CT scan for example, you want to be in an institution that tailors that CT examination specifically for a child. Because of radiation dose, we want to minimize exposure to the child, but at the same time making a correct diagnosis. And we try to choose an imaging procedure that doesn't use radiation to begin with, like ultrasound. And if that doesn't answer the question and we need to do something else, we'll do it at that time. Our new CT scanner that we have, we're seeing radiation doses that are between 40 and 80% lower than some other hospitals or hospitals we're getting patients referred from. So part of it is our staff, our radiologists, really scrutinizing the radiation dose and minimizing it. The other part is the technology. We have the latest generation CT scanner, which allows more adjustability, more ways to reduce radiation doses, whereas in the past that was not always a possibility. I've seen changes in radiation doses that are being emitted from our CT scanners. That's going down, which is a good thing. Additionally, MRI is also advancing. MRI is prone to movement and artifacts from motion, but it's improving. The protocols are improving. The sequences are improving in MRI. So I think we're going to see the use of MRI more in the future, not only because it doesn't use ionizing radiation, but because it's providing great detail, anatomic detail, and functional detail.